Hi, all. Welcome to episode 7 of The Balanced Lens, where today we're talking about the Affordable Care Act, also known as Obamacare. Our podcast examines faith, culture, and politics from a Christian worldview, so we're excited to dig deeper into this topic. Now, for me, this topic is somewhat personal. I was a special education teacher. I saw lots of kids with disabilities, watched them go through the struggle of learning how to live with their disabilities. I worked at a church, stood bedside, watched a lot of people die, a lot of kids die, performed funerals for people. My mom was also a nurse for over 40 years. So, certainly a personal topic to me to think through and talk through. And as we dig deep into this, there's so many different aspects to Obamacare that we're going to be touching on. So, to kick us off, Biju, what is Obamacare? What was its core purpose?
Yeah, it's a pet name, Obamacare. The actual name is the Patient Protection and Affordable Care Act. It's actually not just ACA. That's the expanded version of it. It was passed in March 2010, and at that point, it had three main objectives. Number one, it was to expand the health care insurance coverage. There were a lot of uninsured Americans, and the idea was to expand the coverage and subsidize by expanding Medicaid. So the two ways they were going to do it is one by expanding Medicaid. The second was to subsidize the health insurance marketplaces. The second objective was to reform the private insurance market itself because there were some discriminatory practices which made insurance really hard for people with pre-existing conditions. And that was the way the insurance companies kind of hedge their bet. The act sought to reform that practice. The third objective was to actually shift the focus a little bit from treatment to prevention. So it kind of lowered the out-of-pocket costs of people when they were going for preventative care. And the idea was that it would pay dividends in the long run, that people wouldn't get diseases would be caught early, so you wouldn't have to pay extremely high costs down the line when the disease had progressed. So those were the key objectives of the Affordable Care Act.
Yeah, I think in passing this act, the goal was to make it more affordable, more accessible, more comprehensive. But what's interesting when it comes to healthcare, right, there's this philosophical argument, and it begins with the Constitution, the preamble. The preamble says that Congress has a right to collect taxes to provide for the common defense and general welfare. Well, that's a debated phase, right? What exactly does general welfare mean? For example, we have roads, we have schools that are paid for by taxes, the police, fire departments, emergency services. Does healthcare belong in that same category? This is a philosophical debate. Does the Constitution say that we have this broad, separate spending power to spend on healthcare? There's also the philosophical question of personal responsibility, right? If I'm uninsured and already sick and I go whitewater rafting and I hit my head on a rock, who pays? The government or do I pay? So, um, healthcare is a tricky topic, right? It was intended, the Affordable Care Act was intended to solve these problems. But as we dig into this topic, we're going to see it touches on so many underlying philosophical debates. But to kick it off, right, when we get into the details of this, how did this affect people without coverage or pre existing conditions?
Pre-existing condition piece was actually one of the most significant portions of the reform. Number one, guaranteed the issue, and it is not based on any pre-existing conditions. Two, it kind of took out discrimination practices where higher premiums would be charged to people who had a medical history or some type of health status. And three, it eliminated this concept of lifetime limits, that benefits for individuals based on how much money has been spent on them over the years. And therefore, it kind of protected people who had like chronic conditions for no fault of their own. And this kind of backs into one of the points you were talking about, Dennis, where there's this debate, right? Like, should the general public take over this burden? A lot of it is a moral debate. It's not just a moral, even philosophical debate, not just a purely numbers one. So yeah, that was the idea. And just from an impact perspective, data shows that a lot of people with pre-existing conditions and all got the insurance coverage post the implementation of this act. So like one example is like, there were people who were getting coverage through community health centers. The decade before the act was passed was about 50% of them had pre-existing conditions. After the act, it became 70%. So there was a shift in the number of people, the percent of people who were getting coverage in spite of their pre-existing conditions.
Yeah, and as Christians, I think that's a good thing, right? That's something we should celebrate. Sometimes the news makes you think, well, Obamacare, government intrusion, higher premiums, but we overlooked some of the basic facts that there were good things that actually came out of the Affordable Care Act. That segues into our next question, right? How did this affect overall rates of insurance coverage? And Biju, you kind of touched on this, but there was a large drop in the uninsured rate before ACA's major coverage expansions took effect. 14 to 16% of Americans lacked health insurance. That's a huge number. By 2023, they had dropped to 7 and 8%, so nearly cut in half. In terms of the actual amount, there were fewer uninsured people overall. The count of uninsured individuals dropped from about 45 million in 2013, all the way to 26.4 million in 2022. Again, this was 3 years after ACA, and then almost a decade later. So a lot of progress there. Like you mentioned, Vidya, millions gained coverage. The uninsured rate fell sharply, expanded coverage, especially for vulnerable groups, low income individuals, young adults, racial, ethnic minorities, groups that had historically high uninsurance rates. And like you mentioned, it also banned insurers from denying coverage or charging more based on pre existing conditions. For those of you who have a pre existing condition and you lived before 2010, you know what rates were like. Or you were just denied coverage, sadly. And so there are good things that came out of the Affordable Care Act that we do want to highlight. Again, we're balanced, right? We're not here to push one viewpoint or the other, whether it's the right or left. But in my opinion, these were some good things that came out of this.
I mean, one of the things that I will mention here is just the fact that it is called Obamacare, just it triggers people. Just like on one side, if you say something called this is the Trump gold coin or whatever, right? Because these individuals trigger certain feelings because they're on one side of the spectrum versus the other. And I think that itself is a very unfair way to talk about a topic like this. It should always be based on its merits and just call it the Affordable Care Act, which was the essence of what it was trying to do. And take Obama out of the picture. It was something that and just so our audience's perspective, this was the biggest healthcare reform since you have to go all the way back to the 60s where the Medicaid and Medicare acts were passed. This is the next big one that came, and it solved a real problem that was there. You could argue, was there a better way to solve it, right? And if there was, why wasn't it solved prior to President Obama taking office? So we can argue on either sides of the spectrum, and to this day, the argument goes on. But I think the fact that it made a tangible impact on the lives of millions of people, especially those who are not as privileged and suffer from conditions generally not of their own, like they didn't make a choice to have those chronic conditions, it is a good thing. And I definitely celebrate that part of it.
Yeah, and to put this in perspective, right, I don't think we in America actually realize this, but amongst other top developed countries, Western Europe, Canada, Japan, Australia, uninsured population rate is tiny. It's often under 1 to 3%. It's still about 8 to 10% here in the US. We still have a significantly high amount of people that are uninsured. But in terms of developed countries, we still lag behind that area in that particular statistic. So it's important to see the context of our healthcare system with other countries when it comes to the rate of people that are uninsured. But digging into this a little more, how did this affect coverage for young adults and dependents?
That was another big piece. It made a big shift in that population specifically. The provision in question that we're talking about is where it required all plans to expand their age from the till until 26. So until 26, kids were allowed to stay on their parents' health care plan, regardless of whether they are a student or not. And that had an immediate impact. Like the cover, like the uninsured, the percent uninsured for this age group, 19 to 25, was about 32% in 2009 prior to the act. And then fast forward to 2023, we are talking about 13% uninsured rate. So it was a dramatic impact that it made. And we probably did not know this back then, but if you look at how many kids who come out of college, etc., are still living with their parents and they are not able to maybe either find a job, a good job, or be independent and stay on their own, you can see how this is making a tangible impact today, even more than they even envisioned when they actually passed the act.
Yeah, and this is one point that's interesting, right? And I might add on to this and say this that there were some unintended consequences created from this as well. But like you mentioned, I think a good thing, Biju, is that the uninsured rate among young people dropped. That's a good thing, right? But I think one thing it did, it also fostered an unhealthy dependency. I think accepting cases of illness or genuine hardship, allowing adult children to remain on the person's insurance created this unhealthy dependency. Think about it this way. When a young person, they have housing, they have food, they have medical coverage provided without personal responsibility, urgency to pursue a stable employment or build a career is often reduced. I think it can delay maturity, weaken the development of personal accountability, traits that are needed to really participate and have a stake in the economy. So I think there's a aspect there that was unintended, perhaps. From a Judeo-Christian perspective, I think it's interesting the concept of accountability begins at an early age. In the Jewish tradition, 13, scripture emphasizing training children toward responsibility and adulthood. Again, I think the reducing the number of uninsured population under 26 is great. That's a wonderful thing. But did we create this unhealthy codependency on insurance coverage that maybe prolong this development of good responsibility in young men and young women? So something to think about there when we think through this. But when it comes to the actual providers, right? How did this affect the number of insurance choices?
As expected, there was a lot of turmoil in the market. Let's put it that way. Employers, like we all work for, most of us work for regular corporates, and we know we have seen tangible rise in our expenses, both in premiums and out-of-pocket costs going up. And this act certainly caused some of that turmoil early on, but I would say like it has calmed down since the first 3-4 years. Even though it was passed in 2010, all the major provisions really went into full force around 2014. And the turmoil in the market started around that time for the next 2, 3, 4 years, or till about, say, 2017, 18. But after that, the markets calmed down a little bit. So early on, there was a mixed reaction. A lot of providers got in the market to see what they can make of it. And then a lot of people withdrew because they were losing money. And there was a time when in a lot of states, people did not have a lot of options because the number of providers went down. But that has since the markets adjusted. And now in almost every, like in majority of the states, you do have at least, say, 3 options is the latest statistic. So it's definitely calmed down and it's adjusted. But the problem, the biggest issue that you see is like there are 2 components, right? One is the premiums going up and the other is as a deductible going up. So sometimes the premiums haven't gone up that much if you compare pre-ACA and post-ACA, but the deductibles have gone up. So it makes the argument from critics then is like, well, if the deductibles have gone up, my out-of-pocket expense is still high, or it's going higher. It's not quote unquote affordable like what the act was supposed to do.
Yeah, totally agree. And when Obama pitched the plan, he said this verbatim, if you like your healthcare plan, you can keep it. The reality is millions of Americans lost their plans for the reasons that you mentioned. In the initial years, post 2014, a lot of participating insurers and total number of plan choices decreased. Some of those reasons, though, were interesting. Number one, a lot of the insurance companies didn't expect a sicker risk pool. Insurers, they paid out more medical claims and their premiums actually covered. This led to financial losses, and a lot of these insurance companies weren't ready for the risk that they were taking on. Secondly, a lot of the regulatory mandates, they limited flexibility. Under ACA, insurers had to accept all applicants, right? You couldn't deny coverage anymore, regardless of health status. They had to adhere to these standardized benefits. Their ability to segment risk or price policies, aggressively based on health, that gave insurers less control. Another interesting thing is that there was something called the Risk Corridor Program, where the ACA included this temporary risk corridor payment to help insurers who lost money early on to reduce their risk of insolvency. However, what happened, that was not funded well. There was political opposition. Many insurers received far less than promised. So this whole risk corridor program failed. There was failed risk stabilization. Then there was policy uncertainty. People were worried. Was this going to be repealed? Is this going to really endure the next presidency? Insurers worried that critical parts would not remain. And so there was uncertainty that made offering plans riskier. And then again, this is in poor financial results, just created unsustainable business models in the early years. But like you mentioned, post 2019, we see insurers coming back into the market, more choices, increased competition since 2021. For example, in 2021, 30 insurers entered the individual market across 20 states. 61 others expanded their service within states that they already operated. While there was this initial dip in plan availability, the ACA market has stabilized. So it's important to No, the balanced view of that, it was bad at first, but now stabilized. Now, interesting part about Obamacare, right? And it had a good effect on preventative care, right? And so I'll segue like this. Preventative care is good. There's a strong positive correlation between preventative care and overall health. For example, preventative measures can reduce the risk of diseases. We can detect illnesses earlier. We improve the quality of life. Things like regular checkups, screenings, vaccinations, they help prevent chronic disease, early detection. All these things improve health outcomes, they lower health costs. Because the ACA made preventative service widely covered and free for many people, including many people who gained insurance through the law, millions more Americans gained access to preventative care, and usage rates increased meaningfully across a range of services. And so, if you're a Christian, you're a believer, and all you hear about is Obamacare and how bad it is and how horrible it is, and Obama was the worst, there are good things that came out of Obamacare, right? And the increase in access to preventative care, I think, was a very good thing.
Yeah, there's nothing more I can say to what you mentioned other than there is a saying, I'm not sure if you've heard, a stitch in time saves nine. So acting early, identifying early warning signs and preventing a disease or catching it early and solving for it and treating it is much easier and faster and manageable and less costly compared to doing so after something's gone awfully wrong and you're in the ER.
Yeah, and for those listeners who want to look this up, there's a study you can look up. There's many studies, but here's one I'll cite. It's from 2015, published in Preventative Medicine. The study is called "Has Recommended Preventative Services Use Increased After Elimination of Cost Sharing as Part of the Affordable Care Act in the United States." Long title there, but here's what the study says. It took a national representative study comparing data from 2009, which is pre-ACA, to 2011, 2012. And here's what it found. There was a significant increase in blood pressure checks, cholesterol checks, flu vaccinations among adults with private insurance. And so what's interesting is that this preventative care, like you said, it creates better health outcomes for people as this was expanded through the Obamacare or Affordable Care Act. Now, this also affected Medicaid expansion in many ways. Did you want to touch on that a little bit?
Yeah. Explicitly sought to expand. The ACA explicitly sought to expand Medicaid, and it's basically a government-run program for low-income households and individuals. And the idea was to cover all non-elderly adults with incomes up to 138% of the FPL, the federal poverty level. That is the idea. The one hiccup that happened was it went to the Supreme Court, and in 2012 they ruled that you cannot mandate the states to have it. So states can opt in or out of the coverage. And so most states opted in. A few of them, the biggest ones being Texas and Florida, opted out of it, but you can see the difference. So if you look at all the states that opted into the Medicaid expansion program, their uninsured rate was like half of other states like Texas and Florida. So the uninsured rate of the opted in states was like 7.6%, and for the ones that opted out, it was like double, like 14-ish%. So there was a meaningful difference in that, but again, the counter argument is like what conservatives will argue is like, by rejecting it and opting out of it, states like Florida and Texas are like preventing massive federal commitments that they will have to somehow compromise, and then probably it'll be a burden on their state budgets down the line. So that would be the conservative argument. But on the flip side, the liberals will argue that there's a coverage gap that is happening because of this opt-in, opt-out mechanism.
Yeah, and there's been hundreds and thousands of studies on the effects of Medicaid expansion. And so I found a really interesting study. This was published in 2020, March 17, 2020. It essentially took over 500 studies and summarized them. 500 studies on Medicaid. And the study that summarized them is called The Effects of Medicaid Expansion Under the ACA, Studies from January 2014 to January 2020. If you want to look it up, the authors are Madeline Guth, Rachel Garfield, and Robin Rudowitz. But these researchers, they extensively studied the effects of Medicaid expansion since its passing in 2010. They examined 484 separate studies to assess how expansion of Medicaid influenced various health, financial, and access-related outcomes. And so this is really interesting, right? They grouped the studies whether based on whether they were positive, indifferent, or negative. When it came to Medicaid and the access and utility of care, 115 studies said there was a positive influence, 30, no difference. When it came to insurance coverage, 138 studies said there was a positive influence, 6 indifferent. When it comes to the payer mix, 71 studies said this was positive, 2 indifferent. Healthcare affordability and financial security, 50 studies said that this had a positive impact on healthcare affordability and financial security, 6 indifferent. Provider capacity, how many patients the healthcare system can actually care for within a given time frame. 16 studies said that there was a positive influence. There's actually 19 studies that said it was indifferent, and 3 that showed there was a negative impact, primarily because you have so many people now entering the system at one time. In terms of self-reported health, positive health outcomes, again, 15 studies showing positive self-reported health outcomes, 9 studies showing positive health outcomes, 6 indifferent. In general, when it comes to Medicaid expansion, right, I think you've seen positive outcomes in the general health of people. I think that's been a good thing. Now, again, conservatives will argue government costs, it's been expensive. True, but you need to ask yourself the question, right? Has this actually helped people, right? And I'm not diminishing the cost. We're going to get to cost in a second. So, but there have been a lot of positive outcomes from Obamacare.
Even for hospitals, by the way, right? So, like, remember, like, if anyone shows in the ER, they still have to take care of them. So, one of the things that hospitals have reported is like there's been a positive financial outcome for them because now you've expanded the coverage.
Right.
So, those unexpected write-offs are limited, and it's helped them to be more financially healthy.
Yeah, excellent point. Right. Prior to this, prior to the ACA, right? Those were just write-offs for those that came in uninsured. So great point. But, getting to the details of this, right? And this is what you hear a lot on the news. How did Obamacare affect overall insurance premiums? I'll segue this. The Affordable Care Act became very unaffordable for the middle class. Initially, Obamacare was touted as saying that every family would have $2,500 savings in premiums. In reality, it's been about 100% increase in about a decade or so. To give you an idea of the cost trend, 810, the average annual family premium on an employer plan was about 13,800 in 2025. This is now about 26 to 27,000. So the costs have gone up astronomically, right? And so this is why no one's happy about healthcare. It's gotten expensive if you're in the middle class and you don't get as many subsidies as other people.
Yep, absolutely. This is where it's become unaffordable and people are frustrated. And this is just one aspect of the affordability crisis that we are in, right? A lot of people are frustrated, including us, right? It's nice to see that your gross salary is so much per annum, and then you're like, where is it all going?
Yeah.
So it's just it is a true it's a true and tried statement that the affordability crisis is real and the premiums have gone up, and this is in spite of the subsidies. Right? So imagine if it were not for the subsidies, this would have been a truly gigantic increase. Now, to be fair, insurance premiums have always been going up, and it's going up. The rate at which premiums have been going up over the years is much higher than our annual salary increases that you would get from a cost of living adjustment perspective. So we have not, like, our buying power is going down over the years. And the other part of this equation is deductible. And the hard part when you evaluate these different insurances is like you've got now different brackets. You've got the platinum, gold, silver brackets, and then there's a lot of deductible costs involved, which means that you end up paying so much out of pocket in order to get your premiums to a more manageable amount. It's a very tricky balance because you don't know what's going to happen in the year, so you don't know which one's actually going to win out when the year is done. So it's just enough. We have an affordability crisis in this country. Part of it is, I'm not going to put it all on the ACA though. ACA, even if it were not for the ACA, premiums would have still gone up.
Yeah, I'm going to talk about some of those issues when it comes to solutions. But regarding cost, what's also interesting, right? If you think about cost compared to other Western developed countries, and this is according to data from the Organization for Economic Cooperation and Development. You can Google our world and data. There's many studies that cite this, but the U.S. is the highest healthcare spending per capita compared to other countries like Japan, Italy, Germany, Switzerland, Finland, and Portugal. But, and here's the catcher, our life expectancy is lower. Our life expectancy is 79.3, whereas for Japan it's 84.7, France 83, Switzerland 83, Spain 83.6, Germany 81. Ultimately we're spending more, but our life expectancy is still lower than all of these countries. And so, I think it's important to put costs in perspective with overall health and well-being. And so, very interesting when you look at it that way. But one of the culprits in this, I'll call them, I don't know how else to name them, but healthcare companies, right? How did healthcare companies benefit from Obamacare? I call them culprits. Are they villains? How much have they made here? And I can go through this if you want. Go ahead.
Yeah, like untangling the complex healthcare system we have in the US is really a task. If you get to see the raw bill that you get, like I remember when my wife was pregnant and we got the bill from the hospital after my child was born, I was like, what am I looking at? Like, it is just unbelievable.
You forgot about the baby, right?
It is just out of control. And part of it is transparency. I know there have been a lot of effort to improve transparency of costs and in the bills that you see. But for the most part, if it as an end user, so let me give perspective, right? So I just came back from India. My parents live there. And I go around to different hospitals. I kind of get an idea of like my dad needs to do a cataract surgery. How much does it cost? Then I'll go get a second opinion, third opinion. I'll ask them for their cost and everything. And I'll get an idea like where it lands. And I compare that to the reputation of the hospital, obviously, and then make a decision. There is nothing of the sort that's happening here. I don't go shopping around for anything. I just try to look at a good reputable doctor that's close by and I just go and see the person. So like there is something like, and I know there's a broader discussion, but in terms of an individual rights and what are our responsibilities as individuals and responsible citizens of this country, we have to do the due diligence of picking the right balance of like how we compare different hospitals, what is the cost here, what's the cost there. We have to demand more transparency up front so we are able to make those decisions. Now, I know I said that about India, but on the flip side, the problem is in India. Like if my dad is going to the critical care unit, the ICU, they want me to deposit money before they will take care of him, right? So, and I'm talking to the private hospitals. The government hospitals are still free, but this is the balance. Like I just want to make sure that I just did not tell the positive side of India, but then that's the negative side, right? This is the balance that we have to make, like individual responsibility versus moral responsibility, and how do we, as a developed country that is a shining example to the world, what is the right balance for us? But I will say that based on the data, all the healthcare companies have thrived. Their customer base has grown because of the Medicare expansion. There's a lot more subsidies coming from the government. Stock prices have doubled plus. So their revenue base has grown, their customer base has grown, their profits have grown. They have not struggled on average. And that's why people tend to sometimes call them culprits. Like, are they part of the problem here? So,
Yeah, you've used a very positive, optimistic word, thrive. I mean, I want to call them like charlatans or thieves. United Healthcare per day, 817 million per day, revenue per day. Cigna revenue per day, 677 million. Anthem, Elevance, 480 million. The compensation of the CEOs, between 20 and 26 million for some of these healthcare CEOs. Stock price increases between 2010 and 2025. United Healthcare, 1,100%. Cigna 822%, Humana 490%, Aetna 600%. So these Obamacare subsidies, to put this in perspective, remember, they're going directly to insurance companies, right? There's not transparency in what's happening between the subsidy and the payment. And, we're going to talk about this in a second. But when it comes to actual solutions, right? What are some solutions here moving forward?
so my initial instinct is like, if it were easy, provided all stakeholders were acting faithfully, it would have been done. I do like the idea Like I know on one extreme, the liberal part of the country will say like, let's make it a single payer system where everybody pays into the system and the government takes care of all the things. And there are places where it works. So it's not, and they point to certain Nordic countries and maybe places like Singapore, to some extent Canada. But the issue is like, we're not talking about the similar population sites and the same dynamics in these countries. Plus, like, one of the things, and we should do a segment about some of the Nordic countries and what we can learn from them. But one of the things that I remember reading is it's easy when there is a cultural alignment to what is expected. Like a society needs to agree on the norms that we're setting. It's much more easy to do that when you have values and cultures that align, right? Like it's more homogeneous is what I mean. We are a very dynamic and heterogeneous country, and it's very hard to get everybody to align on here are some core principles as a society that we, like, how you were mentioning as a Christian, like if we were truly a Christian country in the way we behave and we think right now, yes, as a society, we would have all had a similar attitude towards what needs to be done. But that's not the case in the US anymore. We have a lot of different values and value systems that are in play here. So we are not aligned on that, right? So anyway, so one of the option the liberals again argue is like let's have the government run this whole system, but there are a lot of things that you have to think through before you go and make that extreme step. Generally speaking, when you discourage competition, and it generally is not an efficient, it doesn't run efficiently, and it's true of many things that the government runs. And I don't think many people will even argue against it. The argument that liberals make is like, just like you were mentioning about how much payout these companies are getting, the CEOs are getting, how much money they're making, they are arguing that the selfishness of a few is preventing the welfare of many, right? And so this is the thing that we have to balance. But I do like the idea of like the maybe have a public option where the one option is run by the government, and let's make it a little more open competition, so that no, you have to be careful. It's an open competition. You have to play fairly, and if you play fairly, people who want to opt for the government option can opt for it. If they want to go for private insurance, you can still go for it. So you're still maintaining the framework of capitalism that we have, but creating one more layer of competition that hopefully is fair and not like extra subsidized, right? And that's one. And the second is like opening boundaries between states. Again, like you have to think through it a little bit, but just encouraging more competition, number one. But number two, I think, is the transparency. Like, are we able to get those options in front of us and make a decision without going through like weeks of research, which nobody has the time and the mental energy to do? So those are some of my thoughts. I know it's not a cohesive, simple solution, but I will be honest, I'm still thinking through it. What would be a good solution here?
A lot of people have done studies on the healthcare system, and one of the most consistent points of reforming the healthcare system that many studies have proposed, this is based on good studies with key research with a lot of data, is from shifting from a fee-for-service system to a value-based payment system. Basically, here's what I mean. In the current system, more tests means more visits means more revenue. There's really no incentive to prevent disease or coordinate care. This drives overtreatment. It creates cost inflation. This has been cited in the New England Journal of Medicine, the National Academies of Accounting for Social Risk Factors, OECD payment analysis. But studies consistently show that value-based payments, right, they produce fewer unnecessary procedures, lower hospital readmissions, better chronic disease management, and reduce overall costs. So the idea is this, right? How do we coordinate treatment where we're paying people on preventing disease, not just on ordering another test? How do we actually examine the outcomes of each patient's health assessment plan or health goals and ensure that they're being taken care of, and a doctor who can produce a positive health outcome is being reimbursed based on that outcome, not on the 10th x-ray that they order, right? So that's number one. Number two, expanding primary and preventative care capacity. The U.S. underinvests in family medicine. The U.S. underinvests in pediatrics, preventative screenings, community health centers. Meanwhile, specialty and hospital care dominate spending, often treating problems that could have been prevented. Another type of prevention is mobile preventative care, which is basically, a mini doctor's office going through neighborhoods. Many research journals, including Harvard studies, have studied mobile preventative care with very positive findings. But strong primary care foundations create lower mortality, fewer ER visits, lower total spending, higher patient satisfaction. Strengthening this primary care, it lowers costs while improving patient health and population health of those that are sick. Thirdly, I think it's important to rebuild provider capacity and the supply of good hospital staff. Coverage has expanded faster than clinician supply. Turnover and burnout is really high. Talk to any nurse, talk to any doctor. There's like a 50 or 60% burnout rate amongst these professions. Shortages are especially severe in primary care, like psychiatry, rural communities, nursing. This drives wait times, are overcrowding, treatment delays. Studies support that expanding, medical school and residency slots is good. Right? We want to increase the supply of our healthcare workers. Studies show that expanding how much a nurse practitioner can do, that scope of practice expansion, right? Allow them to provide more treatments that they normally are limited to not doing. Allow them to do more of the work that doctors do. Rural pipeline programs, immigration reforms for medical professionals. What can we do to get qualified doctors from other countries into our country to improve our healthcare system? All this improves access, improves faster care delivery, reduces emergency care reliance. There's lower burnout rates because now instead of one nurse walking through a hall in a hospital or holding down a floor, there's now 10, right? That's a good thing. Another big thing is to simplify insurance and administrative complexity. Administrative waste in the US is the largest source of inefficiency in US healthcare spending. The US has the world's highest healthcare administrative burden. And if you're in this field, billing complexity, coding requirements, prior authorization. If you ever called someone for a prior authorization, sometimes it's like 5 calls. There's fragmented insurance rules, right? These administrative costs consume 25 to 30% of the US healthcare spending, far higher than peer nations. We can have substantial savings from some type of standardized billing, right? Reduced documentation burden, simplified insurance rules, more automated claims. We have cutting edge AI in this country, but we're still billing and coding sometimes these things by hand. Harvard Health Policy Research has talked a lot about these administrative costs. The Journal of an American Medical Association has talked about administrative costs and many studies there. Lastly, and this is something that you touched on, Biju, it's strengthening competition and price transparency. You just talked about India, right, and comparing prices there. But in the US, healthcare, the price often depends more on the building you walk through than the treatment you receive. I'm going to share some examples here, but healthcare pricing lacks competitive discipline. Prices vary wildly for identical services. Patients do not know cost beforehand. Provider consolidation decreases competition. Like in one city, you might have a hospital that owns all the urgent cares and the urgent care centers, all the clinics, and then the main hospital. Now, JAMA studied this, the Journal of the American Medical Association. They published a study and they looked at the practices of some of these cost differences and they analyzed commercial insurance claims. They found major price swings for some basic services. For example, when it comes to an MRI, they noticed that within the same metro area or within a few miles, the cost of a MRI varied by more than 10 times depending on the place you went to. You walk into a local clinic, the MRI could be a few $100s. You walk into a hospital, it can be a few thousand. You go to a good teaching hospital, that cost goes up to $3,000 to $5,000. A basic blood test, CBC blood count, the cost difference can exceed, over $1,500 based on where you go to, right? For a basic blood test. X-rays have been studied. Some hospitals charge 30 times more than standalone imaging centers. It's pretty insane, right? I had some of these prices here, but don't have time to read them, right? But why do these prices exist? There's no real consumer shopping, hospital monopolies, negotiated insurance contracts. Each insurer negotiates separately. There's no uniform pricing. Same service, different insurers, different reimbursement. There's cross-subsidization. Hospitals inflate prices in one department to cover losses elsewhere, like in the ER. Opaque billing systems. You kind of mentioned this and alluded to this, but there's multiple price layers. There's the charge master, which is a list price, which is basically meaningless. There's a negotiated rate, which no one really knows or sees, which is insurer specific. Then there's the patient responsibility. And the patient rarely knows any of these numbers. I know I don't. Maybe you can look it up somewhere on some website, but I had no idea like how much an x-ray will cost if I go to a hospital. In other countries, much different. Other developed nations, they avoid this problem. They set national fee schedules. They enforce uniform reimbursement. They prohibit hospital price discrimination. And so in the US, we don't see prices. We can't postpone purchases. We don't choose our providers freely. Competition is suppressed. As a result, prices are set by powerful hospitals or market power, not the actual value. And so we need transparency. We need competition when it comes to the healthcare system. So yeah, those are just some big things that are hard to implement. It's not as simple as just giving someone $100 and telling them to spend it on healthcare. I don't think that's going to be a solution here.
The one thing I would say is, as we think through solutions, we have to consider the question of why are we getting so sick? What is causing all the illness? Some of the Nordic countries and the European countries we were talking about and you were quoting, they have a different system, right? A lot of people who visit those countries come back and talk about how relaxed things look like, how people take breaks and they are out drinking coffee together and walking together. And it begs, I think we need to take a completely different outlook for this problem and think about what is making us so sick. We are widely regarded as one of the most overt countries. So I think that's part of it. Like we have to think about that. I would also say, like, I know that I go to my chiropractor for adjusting my back and things, and I know they don't get coverage, right? There's no insurance coverage for that. So it's all I just have to pay whatever the bill is. And the question is why? Like it's so much easier to do that than go to the hospital and get an X-ray and MRI and whatever else that they will do. So these type of like scientific evidence-backed practices like chiropractors and like you can talk about homeopathy, you talk about Ayurvedic treatment centers. These are no longer just like cultural like back office stuff that is done, treatments that are done. There are a lot of clinical studies that have been developed around it. Like homeopathy, if I remember correct, is even popular in Germany. So like we have to think about when we talk about competition and other things, like give people options, right? The way our whole system is set up discourages people from going to the chiropractor. Instead, you have to go to the hospital to get coverage.
Mhm.
So like those kind of discriminatory practices actually is stifling competition. Let them all battle on the merits and give people the choice to go for whatever they wish, but don't stop them in the name of covering certain things and subsidizing certain areas of medicine. So that is the other thought I had. So we do need to think about this more broadly and think of like as a nation, as a society, do we need to rethink the norms and the structures that we have in place so that we can encourage more preventative actions, right? And that includes a whole host of things, right? It's not just breaks and relaxations and more days off. It goes into food. Like if one of the things, right? Like if we are one of the 2 countries or 3 countries in the world that allows direct to consumer advertising on TV, like pharmaceuticals are directly advertising to consumers about their products. It's not allowed in most developed nations. And food as well, like a lot of ultra processed food. And I know that RFK Jr. is trying to get some of the things rectified by making more healthy. That's why a lot of our products are not even imported into Europe because their standards are high enough to our products don't even match those standards. So if our products are not good enough and healthy enough to be imported into Europe and Canada, we have to ask serious questions about like what is going on and how do we truly do like don't just leave everything like the excuse for everything cannot be just capitalism. You have to have boundaries that make sense that look after the welfare of your citizens.
Yeah, 100% agree. And to add on to your point about the food supply, I mean, that was an idea that I thought in my research that came to the top of my mind. I mean, there should be a great priority to restore integrity, right, to the food supply. Many processed foods contain chemicals that undermine our health over time, contributing to chronic disease, preventable suffering, ultimately death. For example, in the EU and even the UK, which has still adopted some of these UA standards after they left, potassium bromate is a chemical used in baking to make dough rise. It's considered a human carcinogen, banned in the UK and EU. I'll try to pronounce this next one, azodicarbonide whitening agent and dough conditioner, brominated vegetable oil, titanium dioxide used in some foods can accumulate in the body, potentially damage DNA, artificial colors, artificial food dyes, yellow number 5, number 6, red number 40 are all banned in the EU and UK. Olestra, a fat substitute that's been banned, BHA, BHT, and it's not just the EU. Other developed countries like Japan, Australia, New Zealand, Canada have also banned these foods. And so cleaning up our food supply, I think, is of utmost importance to manage our healthcare in our country. It's what we consume. It's literally what gives life to our bodies. And so final thoughts. Bijou, I'll let you start.
I think, like we said, we really, if we want to solve these problems, we have to go back to what they call first principles, right? Like go back to the root cause of what is going on in our society, not just, yes, on the front end, we have to solve like the healthcare, like the costs, the pricing and all, and the transparency that we were talking about. But underlying, it's about why are we so sick? Why do we need so much care? Because that's what triggers then the cost. I would also say, like when we talk about topics like this, and when we are engaging with our communities around topics like this, I would prefer people talk about it as Affordable Care Act. Do not refer to it as Obamacare, which just simply triggers a response because of the term Obama in front. It's got nothing to do with Obama, right? So if we can have, if we can follow some principles like that, we can have more meaningful discussions with our communities and actually talk about different problems based on what we see and observe and the merits of what it has or hasn't done without insight, without like triggering emotions that are unnecessary and unfruitful to the outcome of the discussion. So that would be my final things. I really would like to see the medical treatments expand to include Ayurvedic treatments, homeopathic treatments, home treatments, or like the chiropractic treatments. That would be really beneficial to this country, and there's no reason we shouldn't be encouraging those.
Absolutely. Excellent points. This is a topic of utmost importance. It's so complex, right? It's not easy. Anyone who says they can solve it with, a strike of a pen is lying to you. But it is so important, right? How we take care of ourselves, the care we receive from our physicians is critical to life. It is our life, right? How do you get treated for a disease in a hospital? It determines whether you live or whether you die. And so, as Christians, as believers, right, we should pray for good outcomes. This shouldn't be a partisan issue. This is a human issue. We should think through solutions that will benefit us all and address various complexities of this. Anyway, I want to thank you guys for listening to our podcast today. If you enjoy our content from the Balanced Lens, we encourage you to like and subscribe and stay tuned for our next episode.